talk about access to basic primary health facility
I'm actually
has
getting
also
there.
been an issue. But you see, I want to talk about what we're doing as regards this HIV burden. I want to know if, as a country, considering the number of the amount of donations and support we get from the international community in the fight against HIV and AIDS, if we have actually done the needful as a country. I want you to speak around that, because tell us, in terms of donations, how much does the country receive? Because I know that the medication, a lot of things, I mean, these are gotten free. It's not like, it's the government of Nigeria. They're gotten from international donors. And then funds are also being, you know, set aside for this from charity organizations across the world and all of that. Has Nigeria actually, been able to use all of this effectively? I mean, are there other issues affecting why these numbers keep rising?
Yes, we've been very judicious with the funding. I'm not saying we are 100% there. I'm not saying we don't have some itches here and there. But yes, we've been very judicious. And that is why the numbers, like I keep emphasizing, they're coming down. But not as steeply as we wanted to, in order to achieve the global target. And like I said, there are many other factors, even beyond health, that is affecting, this prevalence. And I've highlighted some. In terms of the donation, there's HIV came to us as an emergency about 40 years ago, and we have donor partners, international donor partners, the US government in particular, the Global Fund, and so many others that have been assisting since then, particularly with treatment. Yes, you're very correct. All the antiretroviral drugs that we use today are imported. None is produced in Nigeria, and that is why, as a Nigerian government, we're taking steps to to start local production. I want to commend our President Bola Ahmed Tinubu, for setting up the Presidential Value Unlocking Chain Initiative, PVAC, and we are working closely with this organization, with this committee, to ensure that we start local production. I was in China a couple of months back. We actually signed some MOU with some producers of antiretroviral drugs, and we're hoping that come next year, first quarter of next year, they will start their production plant. Not only antiretroviral drugs, also test kits, rapid test kits for the HIV testing, condoms. Many of the condoms we're using now are imported, so we have that, and also, of course, the enabling environment produced, by the government, because now we have tax exemption, zero tax on pharmaceutical companies, zero tax on health commodities, and this serves as an incentive for producers to come and start production here.